Welcome to today's press briefing. Dr. Chang Shuk-Kwan, Head of Communicable Disease of Center for Health Protection, and Dr. Sarah Ho from Hospital Authority. Dr. Chang will report on today's situation. Last night, we've confirmed 25 cases. Case number is 10488 10512. 15 male, 12 female, age between 3 to 81 years old. 4 were from temporary testing centers. 4. And there's 1 imported cases from an aircrew from Belgium arriving from 31st of January. The other 24 cases are local race cases, and 4 which are unlinked cases. The other 20 cases are linked to other cases, including 5 from the 3rd runway construction site. 1 is a worker, as mentioned from yesterday. The other 4 were the close contacts picked up at temporary testing centers. We have confirmed case from elderly home, as mentioned yesterday, in the Salvation Army Namshan residence for senior citizens resident. We have 1 more worker detected. And for the whole residence, the worker have taken care of the residents and worked in another floor. We will now arrange that everyone in 2 floors, that means all the staff of residents will be sent to quarantine, as we have 2 workers and 1 resident infected. The other 14 cases are linked to other cases. Among the unlinked cases, the 4 of these cases are buildings subject to compulsory testing. And Henghua 1 Estate of Meiwa House, Chengguan O, Beverly Garden Block 9, Yun Long, Tong Tao Po Village, number 16, and Twin Moon Yao Oi Estate Oi Phi House. We need to check that whether we need to split up. And from the linked cases, 2 of the cases were related to other cases. They are friends that between the 28th and 29th held a gathering at their friend's place on the 28th. So far, we have 5 to 6 cases so far, 3 which include the 2 cases today. Worked at a Uniqlo store and Langham Place. Some work at full-time, some work part-time. We yet to identify the source of transmission, which may be caused by the friends gathering or could be infected at the workplace, as 3 of those work in that store. Today, we'll order a compulsory testing order for the Langham Place Uniqlo store on the 5th floor. For those who visited after January 14 or work there, whether they work full-time or part-time, they will require to undergo testing. Their close contact will need to be sent to quarantine. At the Laguna City, we took some environment samples, 30 in total. 1 turned up positive. At the washing basin of a unit with a confirmed case. And for the cases from 501, and for these are the cases carrying the 501 mutation. Case number 9106, 9133, 9800, and 1802, and 1871. And 9106 arrived from Pakistan on the 5th of January and confirmed at the airport testing center. And 9133 arrived from Ireland via Dubai, arrived on the 6th of January. And 980 on the 19th of January from Dubai. These are the cases picked up at the airport. And 9802 arrived from Dubai on the 19th of January and detected at the airport. And 9871 arrived from Switzerland and confirmed at the airport testing centers. These are the cases carrying the 501Y mutation. We're yet to break them down. And now the Dr. Sarah Hill will report on the hospital's authority situation. As of today, 9 a.m., in the past 24 hours, the HA have reported a total of 57 cases. In the past 24 hours, we have no patients succumb to the disease. We have issued a press release earlier. Case number 8443, a 78-year-old male, and on 23rd of December last year, he was confirmed with COVID-19 and checked into the isolation ward in Chunmun Hospital for treatment. His condition continued to deteriorate and transferred to ICU, and finally passed away at around 10:08 a.m. Together with this case, we have a total of 178 patients passed away in public hospitals. 75 confirmed cases recovered and discharged. Currently, we have 9,549 patients recovered and discharged. As of today, 9 a.m., we have 924 patients in 23 public hospitals and Asia World Expo Community Treatment Facility for treatment. 31 are in a critical condition, 31 in a serious condition, and 662 in a stable condition. Negative pressure wards stand at 1,231, utilization at 61%. Negative pressure wards stand at 672, utilization at 70%. And that's the end of my report. And please speak through your microphone and state the media you represent.
AM 7:30.